For the hour, and you're looking live at Main Street, St. Charles. There are long lines just 1 hour out from a new closing deadline for bars and restaurants in St. Charles County. Tonight is the first night of the new mandate meant to cut the spread of the coronavirus. Good evening. I'm Samantha Jones.
And I'm Corey Stark. Tonight, our whole region's medical professionals are concerned about how the holiday weekend could balloon COVID cases and deaths. There's new data from Johns Hopkins University giving perspective to our troubling situation. This scale shows the virus's growth in Missouri since day one. Researchers say cases are doubling every month now.
That keeps spilling over into our hospitals. They're getting overloaded, and the trickle-down effect is forcing ambulances to tap the brakes. News 4's Ashley Lincoln is live with new information on the story we brought you first about medics getting delayed by the ER overload.
Well, Samantha, we found out that our ERs are tasked with admitting both COVID and non-COVID patients. This leads professionals to be up against what's called wall time at our local hospitals, and that is the amount of time paramedics have to wait when dropping patients off. It's a wait time.
Obviously, we're seeing a lot more COVID patients.
St. Louis emergency rooms say they hope doesn't go up.
We are concerned we are going to see a larger number of people in our emergency departments in the coming weeks.
And it's not just the number of sick people walking in leaders are concerned about, but also the patients who arrive by ambulance.
This is something none of us have seen in our careers.
It's called wall time.
How long an ambulance is waiting.
Alok Sangupta oversees operations for all of Mercy's hospitals, emergency rooms in the St. Louis metro area.
We don't want them in our emergency departments waiting.
He says while right now they are not at their breaking point regarding wall time, it does vary from mercy to mercy. However, the numbers are concerning. Recently, Sangupta's team of leaders and other surrounding hospitals met with the EMS Oversight Committee.
We have heard stories in other parts of the country where ambulances are waiting hours sometimes to drop patients off.
Multiple strategies are under discussion to prevent long wall times. But Sangupta says typically a paramedic shouldn't wait longer than 15 minutes to drop off patients, minutes that could be crucial for survival.
We have had extended waits dropping off patients.
Edwardsville first responders say things are getting worse.
And that doesn't just affect the COVID patients, that affects every patient.
You're getting these positive tests from a couple weeks ago, and patients 7 to 10 days after that are when they're the sickest from COVID, we've learned. And so the concern is if we have more positive cases 2 weeks ago, those are going to translate to more ED visits and hospitalizations.
So I asked for a few ways hospitals plan to manage this. Some told me that they will have a team of nurses that will be in contact with paramedics when they arrive to these hospitals. They also say that they plan to monitor the bed space, as we've been telling you about over these months. And Samantha, they also tell us that they plan to monitor staffing in the ERs. That staffing level will fluctuate depending upon the demand placed on the ERs during specific times of the day.
Hospitals certainly stretched thin. Ashley, live for us at SLU Hospital in Midtown tonight. Thank you.